Hi, my name is Ishpreet Singh. I'm on the PGY for residents here at Upstate University Hospital in the Neurology Department. I have with me Dr. Jenny Meyer. She's our new program director. She took over from Dr. Deborah Bradshaw this past year, and this is her first year as a program director. So, Dr. Jenny Meyer, how's it going?
Oh, it's good. It's really interesting because I was the associate program director, as you know, for the last year. But you really don't realize how much a program director does until you step into the shoes. There's a lot more paperwork. Actually, the resident part has been the most fun. We're working with our current residents to work on some different initiatives to try to make things better in terms of resident lifestyle, trying to make sure that the curriculum is a little bit more dynamic and interesting, and then just trying to work on, getting them elective time earlier in their careers so they can be ready for fellowships, things like that. So it's been a very, a lot of learning for me. Because there's a lot of like names of people at the hospital I haven't learned yet, and who to talk to about what, but and a lot of policies to know by heart. But I am slowly memorizing the ACGME policies day by day.
Now, I just touching a base on that. What were your challenges that you faced transitioning from associate to being a program director?
Well, I think Dr. Bradshaw did a really good job of getting me like on the right footing. I think, in terms of the amount of activities that she was doing, I don't think I was really aware because she had been doing it for so long. She was like a well-oiled machine, and I'm still, a newbie. So I think it just takes me a little longer to figure out how to do everything, and also just the flow of all the things that have to happen every year. You guys probably don't even know, but we have credentialing things we have to do for the ACGME to keep the program running. We have to chase down all the faculty for their scholarly activity every year. We have to chase down all the residents for their scholarly activity every year. We have to renew all of our contracts with all of with the VA, for example. And so there's a lot of like back end to running a program that as an associate program director, you don't really have to do. Because your job is really like helping the residents get their credentialing done and more mentorship, less paperwork.
Wow, that's a lot.
Yeah.
Something that took you by surprise that you didn't anticipate?
Um, I think the thing that surprised me the most is how fun it is.
Oh.
Because I think like initially you think of like being a director, like, oh, you're going to have all these requirements that you have to do. But the thing that I thought was the most awesome is that because I'm the director, I have more time to just spend with residents and see what they're doing. And something about like being with people early in their training is just very rejuvenating. So I think after a couple years of just being in my own attending, pathway and just doing my own stuff for a while, it was nice to kind of come back more integrated with the residents, and sort of see them every single week doing different things, and just like being part of their lives more.
Like you were also a medical student here at Upstate, and then you went for your residency. How did this role reversal came across for you? How did it work out for you?
Well, one thing is very interesting is that there are still certain faculty members that I have a hard time calling by their first name, because I was a student here and they were teachers when I was a student. So there are some like very senior attendings that I don't think I'll ever be able to treat informally.
I can understand that.
And even some of the people that I did work with as a student and then have become now my peers, I think the one really cool thing is that there's still a lot of mentorship happening because, they reflect on me and I can go to them and I have those relationships already built. So one of the big things for me about coming back to Upstate was like I already had my roots. Like my roots are here. I know who everybody is. I know what goes on. And so even though I'm still like learning all the nuance of who's in what administration office, I still think that there's a lot of like good mentorship coming my way from the senior faculty, which has made it easier to be moving up into a more senior role.
Do you think there is like any particular personality traits that helps you become like a specific role of program director?
I think one of the big things is you have to be very patient, and you also have to be very understanding, because there's always everything in program is there's two sides to every story, right? There's a reason that whoever is talking about whoever else, there's always a reason why behind both people why they're acting the way they are. And so I think having an open mind and being very understanding is just a essential quality to being a program director. I think if you weren't a very understanding person, or if you're a very rigid person, it would be hard.
Got it. Okay, that's actually very helpful. And just shifting the gears, the ERAS application is going on. What do you think are the important specifications in an applicant's application or the interviews that you pay attention to?
So certainly, I mean, the first thing we always look at is to see if you've passed your boards. Certainly, we do tend to look more closely at people who have passed all of their boards on the first try, for, I think, pretty obvious reasons. But after that, really, I don't know if you know this, but Mary, our coordinator, single-handedly reads about 800 applications a year. And she takes notes and she makes comments about things that she knows that were interesting to us. I mean, certainly we look for connections to the area, because Syracuse, New York, let's face it, it's Syracuse, New York. It's a wonderful place to live. If you have a reason to live here, certainly we look for that, because it's not the top of everyone's bucket list. But I think in terms of other things, we really want people who are very, very interested in neurology, because what's going to sustain you in your residency? It's going to be that you love what you do, right? We look for people who do a lot of teamwork, because as you know, our teams are, the whole system is teams. So if you're not a team player, if you're an individual, if you'd like to do things by yourself, it's probably not the right fit for you. So we, may not be the right program. Other things we look for is just experience. Changing into the U.S. medical system might be difficult depending on where you trained before. And so we just want to see that you're sort of ready to integrate, because as a resident, you have so much to learn already that trying to learn a culture and a system and medicine and neurology just seems like a really tall order.
Yeah, I can understand. So how would you advise the applicants to go about all of these criteria and these requirements?
So I would say definitely, if there are things about you that are unique, put them in your essay. The essay is probably the best window into like who someone is as a
Personal
person. Your personal statement essay. The second one thing I would say is pick people who really know you to write your letters. I don't care if it's the most famous neurologist in the world that you've worked with, because if they can't say anything real about you, if they just say superficial things like Dr. Singh showed up and saw patients with me, that doesn't tell me anything about Dr. Singh. The whole point of me reading this letter is to know who that person is. So I'd much rather see a letter from somebody who knows you very well, who's seen you on all your good and bad days, to tell me the truth. Because the thing is, we're all human beings. We all have good and bad days, and we all have things that we're good at. And if they can't speak to what your real strengths are, then how am I supposed to know? I can see through an empty letter, a million miles away. So the first step is to pick good letter writers and pick people that you trust, because those people are representing you whether you like it or not.
And what would be the red flags for an applicant?
I think if you're somebody who has done research, but you didn't really know exactly, like if you put it on your resume, you should know about it. Because if we ask about it and you don't really know, it's very obvious that you weren't that involved. So like it kind of looks like fluff, like you like kind of put it on there just to show. I would say whatever you put on your resume should be something that you really are invested in. So if you did some volunteer work one day at a time, one day for one organization, and you never worked with them again, probably that one day is not something that should go on your application. Because if I ask you about it and you don't know a lot about the organization or why they're doing it, or it wasn't a big part of your career, you're going to basically come up empty when I ask you the question, so it's going to look bad for you. I would much rather see people who do a lot fewer things, more, but more like can talk about them, because honestly, we all have time limitations and we're not superheroes and we all need sleep. So it's at a certain point, someone who's put a lot of time into one thing can be just as valuable as someone who's done 5 things a little bit.
Yeah, I think this also reflects in our residency. When you become a resident, the work-life balance has been a very big theme in the past few years, and you are also designing the curriculum in a way that has shown the work-life balance is so important for us. So how would you go about, in terms of the residents how they are planned out their residency and their work-life balance, what would you advise the residents?
I would say that, first of all, you have to be true to yourself. So if you're the type of person that doesn't mind getting up in the middle of the night and you love the thrill of the stroke code, then probably vascular is the right move for you. But if you're someone who dreads being on call, probably you should just be honest with yourself and not go that direction. I think there's a lot of, especially amongst different graduates from different places, I think there's a lot of drive to go into specific fields because people think that they'll get a job or they think that they'll be successful. But if you're not happy doing what you're doing and you only have one life to live, like, why are you doing it, right? So I would encourage people to try their best to be honest with what interests them. You know, I thought before I went into neurology, I would be a family medicine doctor.
Wow.
I as a medical student, I thought I was going to do family medicine all the way. And then I realized I don't really like parents. I don't really like wounds.
Okay.
And CSF is the most pure of all body fluids.
Yeah.
I like figuring things out. That was the big thing for me. So neurology, you know, through the course of my medical schooling and my then residency, I realized that the thrill of the puzzle was what was keeping me going. And what's more puzzling than neuromuscular medicine, right? So that's where I ended up. I also like to have a good night's sleep. So there's no such thing as an urgent EMG, emergent EMG. So I don't ever get called in the middle of the night to come in and do one.
That's so important, you know.
Yeah, and it depends on what you want. Like, I mean, I did my fair share of stroke codes too, and they were great and they were fun. But, you know, that was something that I just knew, like, I can't work on this little sleep for this long.
So our passion is really, we should really go for.
Just tell us what you really want, because I think the worst thing you can do is try to pretend to be somebody that you're not really in order to please us. So, you know, obviously we have the ES&I program, which is a big vascular draw. So if you're really interested in doing angiograms and, you know, being on stroke, like, certainly, like, show us that, because that's who we want, you know. If you're somebody who's like on the fence, you could say like, yeah, I'm interested, but you don't have to. You could also just say, I like your neurology residency because you have, you know, neuro-oncology, neuro-immunology, neuro-ophthalmology. You can be honest and just say like, oh yeah, you have this cool program, but I'm actually more interested in these other parts of the program.
Being honesty goes a more long way than anything else when it comes to presenting yourself as an applicant and as a resident, because you also will be applying for fellowships as well. And also, you know, the new academic year is going on. So any advice for the interns you would like to give them?
Oh, yeah. So our interns, the big thing is that you're going to make it through medicine. We all did it. And it's best to do your electives in medicine because you're never really going to be in that thick of it again. So, you know, the things that I learned in my intern year that I still use, you know, like when to worry about DKA, you know, which antibiotics do I give for UTIs, that stuff never goes away. So I would just encourage our neurology residents to just immerse themselves in the joy of learning medicine, because even though it's not why you wanted to go into neurology, it will be extremely useful forever. And I still look back on I can still remember specific patients from when I was an intern that taught me something. And, you know, those relationships that you build with your colleagues and your peers, when you're calling a neuroconsult or you're calling them back for a neuroconsult and you were their co-intern the year before, you know, it's great to already have all those connections. And I think that's why it's so cool that this residency is a categorical, because I went to a program where I was in a categorical situation as well. And, you know, already knowing half the people in the hospital because you worked there for a whole year is really helpful.
And also we get to hang out outside the hospital, and that helps you build rapport with everybody who works in the hospital, and that helps you with everything, as you said, in the hospital as well.
Yeah.
So thank you so much, Dr. Meyer, for talking to me and helping out with the applicants and the residents. So any last words you'd like to add?
I think I would say that maybe I'll just say the reason I would choose Upstate. So if you're looking for a residency that is comprehensive, sees a lot of patients, and is in a place where it's a nice place to live and work and not too expensive, then our program is the right program for you. That would be the type of person I think that does well here. Someone who is kind of looking for that comprehensive neurologic education in a sort of medium-sized city.
All right. Well, those were the golden words from our program director, Dr. Meyer. And thank you again for listening to us. And we'll see you in the next video then. Thank you so much.
Yeah,
Have
bye,
a nice
guys.
day. Bye.